and welcome to Mental Health Foundation's multi-part caregiving series. I'm so honored to be the individual who's facilitating these videos and truly hope that you find them beneficial to your caregiving journey as well as just overall understanding of emotion basics and how to support someone who's struggling in this world. This multi-part series is based off of the two-day EFFT Emotion Focused Family Therapy Caregiver Workshop. The different techniques in it are all out of the workshop. And so whether or not you've attended one before, this can be a great review as well as great learning, especially if those workshops aren't accessible in your area. As always, Mental Health Foundation strives to offer free resources for caregivers because we know what a long process and journey it can be for supporting an individual who's struggling with mental health issues, physical health issues, behavioral issues. I also want to acknowledge that the overall information in this webinar is absolutely advanced caregiving. So it's not something that you would have known or should have had to know when you started offering support to your loved one as they were growing up. But it absolutely can be helpful and a way out, as well as it can be utilized in various different ways of your everyday life. First thing I want to say before we dive into the material is if what you're doing is working, keep doing it. At the end of the day, there's no one way to fix or to support somebody through pain or mental health issues. And so if what you found is working, don't change it up because every single situation is different. That being said, if any of the information in this webinar series is helpful, then please take it, use it, integrate it. But just know that in no way am I suggesting that you have to stop doing what you're doing if it's helpful and start doing what we're offering here. The other piece is there's no single cure for what can never have a single cause. And so I'm going to talk in a few slides about how mental health issues are so multifactorial and there's no one cause, including you didn't cause it. So if you're a parent here and you have self-blame or you're thinking about that one time that you wish that you'd done something differently, we are going to cover that. But I'm going to start off by saying it's not your fault. You didn't cause this, no matter who says what you did or what you didn't do. Absolutely, we can learn how to offer support in a different way, especially if tensions are high. But having high tensions in a relationship doesn't mean that you have the power to cause a mental health issue. And so there's no single cause, there's no single cure, but absolutely there are phenomenal approaches in the world that can support your loved one through the process to recovery. And there's no single person of focus for what can never have a single solution. So Mental Health Foundations really targets caregivers, loved ones of individuals who are struggling because we want to work and harness from a healthier brain point and also harness the power of oxytocin in that relationship and the parent-child attachment. But at the end of the day, like no one person can support someone through this process. No one person can get themselves through this process without the support of others around them. And so I encourage you to build up your community around you in whatever way that looks. Professionals, it might be a couple of friends who you can talk to, it might be family members who come in and help with the behavioral component. And I also appreciate that sometimes it can feel very isolating. It can feel like there isn't anyone or who would I even ask? And so we'll talk about that throughout the series. But at the end of the day, I just hope that you can know that you don't have to be the only one to do this. And at the same time, we want to empower you to do as much as you can within your zone of capacity. We all are at different levels of burnout and time and energy. And so I'm going to be talking a lot about the 1 degree. And the 1 degree being currently where are you and what is 1 degree of change of where you can go? Because Rome wasn't built overnight. Recovery doesn't happen overnight. Change doesn't happen overnight. Although I can assure you that I understand how much we wish it would happen overnight by changing up one thing in the relationship. But this journey is a process. And thinking of the caregivers that I have worked with over the years, they would all say that it is putting it up brick by brick by brick. And so wherever you are in building that road, just know that everything that we're offering you, take a look at what brick you're at and where the next brick is, and then go from there. So why caregiver involvement? Although this series will be accessed by numerous different professionals and caregivers and support people, I want to focus specifically on today on the caregiver involvement, especially parent-child, but any type of caregiver who is supporting an individual with whom they love. Number one reason is that neuroscience supports the healing power of supportive parent-child interactions. And so good news is that no matter how disconnected you are from your loved one and how much they say they don't want you involved, the research actually shows that you have the best chance at harnessing that healing power based on your brain and their brain and the oxytocin that comes through your interactions. And so if you're feeling like, well, I don't know how to do that because my loved one doesn't even really let me offer them support, then you're in the right place. The other piece is that familial emotional style is a factor of the onset and maintenance. So although there's no way that you could have proven this mental health issue, and I'm going to prove that to you, the ways that you interact with your loved one can actually keep them stuck in the patterns of avoidance or the patterns of numbing out. And so by looking at what's going on in the way that you interact, specifically around emotion, then we can absolutely help shift some of those ways that you connect, which can lead to more flexibility towards less need for symptoms. The other thing is that mental health issues and behavioral problems really involve difficulties around symptom management. And so, if you think about the number of individuals who struggle with high symptomology and who access therapy, quite often they need outside support for accountability, but also to help them support changing up their behavior because behavior is used in order to numb out from having to feel. And so, what happens if you've been using symptoms for a very long time as a way of coping? When you stop using symptoms, you may not know how to cope. And so we can actually harness the relationship to help you help your loved one with their symptoms. And I'm going to give you some strategies to be able to interact with them, even when they say, go away, I don't want you, over the next few videos. We've seen that many clients live at home regardless of their age, and caregivers are involved in significant ways. So whether your loved one lives across the country, and you just talk to them through text, or your loved one lives in the same city and they're always over, or your loved one actually lives with you, we know that when an individual is struggling with mental health issues or behavioral issues, that there is interaction, whether it's that you just think of them more often than you think of the other child because you worry about them, or there is any tension between you. At the end of the day, they're connecting home more so than people who have launched and have a healthier way of dealing with the world. And so we want to be able to harness those connections that you have with them. Help If we have caregiver involvement, it actually helps to diffuse the identity issues that get related to needing help. So specifically with children and adolescents, but this can also be true of young adults and adults, is that if you think about it, when we treat mental health issues and behavioral issues, who's usually in therapy? It's usually the person who's struggling. And that's the way that our world has done it for quite some time, at least in our North American society. We're looking to shift that a little bit because if you're the one who has the issues and you're the one who's always going to therapy, then absolutely you're going to integrate into your identity that you have problems and that you need help and that you're not okay and that you're not normal. And so if you can take it to be more of a familial plan of approach and have the caregivers be able to look at some of the dynamics that are happening, it actually helps diffuse some of that self-blame or shame around being someone who's struggling. And what I'm going to show you in a little bit is that when shame and self-blame is lower, we have a way better chance of being able to access our empowerment. And so you can support your loved ones to be able to better access their empowerment by being more involved because you can diffuse some of the responsibility. Not your fault, but you can absolutely help carry some of that burden. Some individuals also refuse treatment or they drop out. And so, if you've ever found yourself in a situation where you know that your loved one needs treatment, they're involved in symptoms, they're using substances, they're acting out in totally explosive ways or avoidant ways, but they refuse treatment, it can often feel like you're stuck. Like you're at the end of the road. Where do I go? What do I do? And so, by accessing this caregiver video series, we're going to give you some ways that you can actually support your loved one, even if they say, I don't want care. No, thank you. Because at the end of the day, if we can support loved ones, like caregivers to support their loved ones, then their loved ones are going to have a better chance of getting through this, even if those individuals don't want to access treatment. I really want to encourage you right now, if you're a caregiver of somebody who is refusing treatment or refusing that there's a problem at all, you can still make a change. It doesn't have to burn you out. We don't want to burn you out. Remember the 1 degree. But through this video series, hopefully you can understand different ways that you can maybe become more efficient at the ways in relating if the things that you're doing aren't bringing back much fruit, to help your loved ones move closer towards accessing support. You are partly giving them support, but then to choose to access treatment or to make those changes because there will be a little more flexibility in their brain and their emotional style. The other piece that I really want to highlight is that as a caregiver, you have the right to support, especially since chronic health and mental health conditions reorganize the family patterns. They reorganize the way that you actually offer care. And so at the end of the day, you absolutely have the right to get access to resources, no matter if your loved one is wanting to get access or wanting to have access or not. And depending on the availability of resources, you may not have this in your area. So we hope that this can help bring you a little bit of encouragement as you follow along with me over the next few videos. But just know that you're not crazy in thinking that you want to have a role in offering support. You might be scared, and I'm going to talk about that today. There might be part of you that's apprehensive because you may have concerns about not knowing what to say or not knowing what to do, or if your loved one's pushing you away, or if you're worried that maybe you'll make it worse in any way. Those are all normal fears in caregivers. Normal. Not helpful, so we're going to look at how we can transform those, but absolutely normal. I want to encourage you that despite those fears and despite what you might be hearing from the general society, which can be quite stigmatized around caregiver involvement, especially if your loved one is an older adolescent or an adult, you have the right to support. You have the right to be involved. You're not crazy in thinking that it's not okay that you don't necessarily know how to offer support or be there to support. So I hope that this can give you some ways that you can interact with your loved one and you can feel encouraged yourself as we go through the material. So as a caregiver, you are an agent of healing. What do I mean by that? So here's a quote from Dr. Adele LaFrance, who's a co-developer of EFFT and absolutely a leader in the field of caregiver involvement around mental health behavioral issues. In addition to providing information, the caregiver is active in leading or co-leading behavioral and emotion-focused interventions in session, at home, by telephone, text, or email, in the service of reducing behavioral symptoms and increasing self-efficacy with emotions. So this may seem kind of overwhelming when you first hear about it. You're like, what? I have to do all of these things? Well, not necessarily. Obviously, optimal, gold standard, you'd all be having access to resources, you'd all be interacting. But I know from working in the field that it's not always that simple to just access support for sessions and to have your loved one living close by, or to even sometimes have a phone conversation with your loved one. But that doesn't mean that you can't help and you can't be an agent of healing. You can be an agent of healing by text or by email. So think of how you currently interact with your loved one. Do you see them face to face? Do you talk to them mostly through text or phone or FaceTime? Do you just email every now and then? That's where you can start with the material that I'm going to be teaching you in these videos. And by starting wherever you are, we can help you build up to having increased connection, but you can actually help reduce the behavioral symptoms and increase their emotional capacity. So self-efficacy is a bit of a confusing word, and it's also one of my favorite words because I think that it really depicts this journey towards well-being. So self-efficacy means, with emotion, means the belief in oneself that they can actually handle emotion, but then the capacity to be able to handle it. So individuals who have low self-efficacy with emotion quite often show, and high level of fear, quite often show as having low motivation. So if you're at all supporting an individual who's presenting with that low motivation, which that motivation word gets me a little bit because I can tell you in the journey towards wellness, motivation can change moment to moment. So one moment the person might be all game to go to treatment and change it up and ask for your support. The next moment they may be saying, I changed my mind, I don't want to get better anymore. Don't buy it. Motivation is directly connected to self-efficacy with emotion and levels of fear. And so if the individual fears that they won't be able to handle the changes, they won't know what to do with the changes, or maybe they're going to fail, and they don't believe that they can handle the pain or the rejection that will be associated with those feelings, they will likely present as very lowly motivated. But that can change. And someone can be 99% motivated, but 100% afraid. And that person will present as a lowly motivated individual. So just know that no matter how motivated your loved one is, or you feel in the moment, that can change, and that's way more directly connected to the levels of fear and the levels of doubt in themselves, as well as their capacity to process and feel emotions. And so through taking this emotion-focused family therapy caregiver video series, I'm going to teach you some ways to be able to harness the power of emotion and actually help increase your loved one's self-efficacy. in order to help them have a little more flexibility and capacity to handle whatever comes when those symptoms are no longer there. So I know that this is a video series, and I wanted to just say that first and foremost, as a society, as a whole, we are all in this together. Now, I can't see you, and this you may be watching this weeks after I recorded it, but I want to acknowledge that you already have skills. You already have skills because you came to this video series, which means that there's a part of you inside that has this intuition that knows that you need more. Or perhaps you're feeling at the end of your rope and it's like, no, Natasha, I don't have skills. I just feel like I need something, something, and this was referred to me. Um, Now, obviously, I can't ask you to demonstrate, but I want you to know that I'm going to demonstrate various different skills in behavior coaching and emotion coaching over the next few videos. And I want to invite you to just take a look at what you're already doing because you may already be doing some of the skills that I'm going to be showing you or parts of them. Um, and if you're not, that's totally okay. I can tell you that I finished my master's degree. I was in a doctorate of clinical psych. And when I learned about emotion focused family therapy, I didn't have any of these skills and I was working as a therapist. So it's not mainstream in our society to be emotion focused, emotion aware. I mean, part of me is a little bit embarrassed to say that I was working as a clinician in the mental health field, both in emergency mental health and eating disorders. And I didn't understand the power of low self efficacy with emotion and emotion basics. Nor did I necessarily understand the power of validating and emotion coaching in order to increase behavioral support. So you may find that everything I'm sharing with you is new. And if that's the case, know like I've been there and we are absolutely all in this together. And even though I can't see your face right now, or this maybe isn't real time, thank you for coming. And I'm talking to you. And you absolutely can make changes, even if they're just little. And at the same time, if some of these skills feel like skills that you've already done or know, then build upon them and helpfully have review and practice them. And absolutely will help you in the next steps of your journey of support. So there was some research that was done a few years ago around EFFT and parental identity of capacity, but there's also research that's just out there in general beyond the EFFT world. And what it was found was that parental fear, this can be true though also for any variation of caregivers. So if you're not maybe the biological parent who is the direct caregiver, or if you're a grandparent or a step parent or somebody working in a group home or whatever variation relationship is, what we know is that fear is directly connected to the level of empowerment and also problematic behaviors and interaction. Now, for the parental piece, I want to acknowledge that self-blame can also keep us so stuck. And I'll be the first to talk about self blame. I have a daughter, and I can tell you that I think that I have noticed the struggle of parental self blame since the moment she was conceived. Maybe it's the burden of teaching this stuff and knowing what advanced caregiving looks like. And so holding myself to that standard, I've had to do some work around that, especially as she has become a three-nager. But at the end of the day, self blame comes up as parents, guilt and self blame comes up and we can work through it. But sometimes when our loved ones struggle, that self blame becomes more embedded and it almost becomes like totally boldened into our minds and our hearts. And so every time that we interact with our loved ones, all we can think about is our story of self blame of what we could have done differently and how the way that they currently experience in the world is directly connected to what we did. If you're experiencing that at all, whether it's the fear of making something worse, and we're going to talk about that in the next video, or it's the blame of wishing you'd done something differently, know that I want to support you to transform that. Because it's a super uncomfortable place to be in, been there in parental fear and self blame, and just in general parenting, and I can tell you that it's a really uncomfortable place to be in. But now add on the fact that you're supporting a loved one who struggles with mental health issues or maybe behavioral issues or substance misuse or any variation of why you're here. I can tell you that that level of fear and self blame will make you feel less empowered and also possibly make you feel like you don't actually have the right to offer your loved one support, as well as could lead to some of the ways that you interact being unhelpful. This actual intervention, so these videos that I'm recording for you, were developed as an empowerment tool. And that's why I'm so excited that you're here, because if anything, if you get anything out of this parental caregiver series, I hope it's that you feel empowered and like you have the right to offer your loved one support no matter where they are. Because what we found in the research and what it generally says is that if we can reduce your parental fear and self blame, it can help you feel more empowered. And if you feel more empowered, then you will more likely have the intuition to be able to take on the tasks that are needed to support your loved one in recovery. But it will also increase your self efficacy with emotion. And if your self efficacy with emotion is increased, then any time that you have those what if thoughts in your brain, now we're going to talk a little bit about that voice inside in a few slides to come. But I think we can all say that quite often, it feels like we have the angel and the devil on our shoulders, or that little voice inside that says, like, don't do that. Because if you do that, what if this happens? And so those what ifs are really just a vocal representation of our low self efficacy, like the fear of things maybe not being able to go okay, or feeling like we can't handle it if that thing happens, which is directly connected to our belief in ourselves to handle the feelings of emotional pain, as well as our belief that we can actually handle it. And so if we can help you become more empowered, and I don't care what your story is in terms of self blame. Of course, I care who you are and what your story is. But the reason why I say I don't care what your story of self blame is because there is nothing that you can tell me that you did or didn't do as a caregiver that's going to make me feel like you do not have the right to feel empowered to offer support. Now, there might be things that have gone on where you're like, no, 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 like it doesn't match up with my values, it doesn't match up with my parenting style, and I can tell you, Natasha, that it's not okay. Okay, maybe those things did happen. That doesn't change the fact that you still have the permission to feel more empowered to offer support. There may be need for relationship repair or to be able to do some circle backs, which we're going to talk about. But at the end of the day, whether your child is in your care or out of your care, or living out of the home because they've grown up, or whatever it is, whatever has happened, you can work towards repairing. But more than that, it doesn't discredit the permission that you have to feel some more empowerment that you currently do to be able to offer support to your loved one in various different ways, no matter how you're currently connecting to them. So speaking of that conversation in our heads, so what we know is that the conversation in our heads actually gets in the way of our best efforts. It blocks us. And we actually call these emotion blocks or caregiver blocks or clinician blocks, because I can tell you as a clinician, I have to work through my own blocks too. And we actually have webinars for clinicians for that. But we're talking about caregivers here. And so I want to just acknowledge that voice in our heads that I talked about. It's that little voice that's like, if you do that, this could go sideways, or that's not okay, or but it's your fault, so you don't have the right to offer support, or if you do that, then this horrific thing might happen, or you might not know what to do, or it might explode, or it might prove that you don't know what you're doing, or it might make you feel pain yourself. And there's a whole variation. And I actually have a resource that I'm going to offer to you in the next video. But for right now, I just want to acknowledge that we all have a voice in our heads, and it's not a schizophrenic voice that's happening from the outside that makes us feel like we don't understand reality. No, what that voice is that tiny little voice inside that some people call in the emotion focused world the inner critic. And essentially, it tells us sometimes stories of the worst things that can happen. This is true for you. This is true for your loved one who you're supporting. This is true for myself as a clinician. This is true for teams who are supporting you if you have a team who you're connecting to. This is true for your family members. And so we're all walking around with these voices in our heads telling us like the what ifs. And the more aware we are, the less that they're going to get in the way of being able to help in a really great way. But the less that we're aware of this little voice, then the less capacity we're going to have to be able to navigate the A, like some of the fear it's bringing up, but B, some of the wisdom that it's bringing up. Because that fear doesn't come from just nowhere. Usually it's founded in a story that we have or a past experience that we have. It doesn't mean that we should just stop in our tracks because of it, but absolutely we can use it to inform how we move forward. I would much rather work with another colleague who knows everything that that voice is saying than when someone who says, oh, I don't have that voice in my head, I believe in everything. So just know that we all have it. And I want to invite you to notice what that little voice in your head is saying, because the more awareness you have, the more that you can harness the wisdom from it. and the less that you'll get stopped in your tracks when you're going to offer support to your loved one. Before we dive in, I know we're kind of diving in right now, but before we dive in even further, I want to just acknowledge the effects of mental health issues and how they literally infiltrate all parts of the family and relationships. So I know if you're here, you may be feeling desperate or at your wit's end. Or there may be part of you that just feels like you need more support because it's just not cutting it with where you currently are. I want to acknowledge that supporting someone who has a mental health issue means that families tend to reorganize themselves around the illness. So if you think of a mobile, and the mobile has everyone in the family equally kind of um, balanced out, and then you bring in a mental health issue, what can happen is that you move that mobile to have the individual who's diagnosed and struggling and the actual symptoms of the mental health issue in the middle of the mobile. What happens if we do that? Well, the whole mobile has to reorganize in order to not fall off kilter. And so that is what has happened, possibly in your family. Maybe not, but tends to happen more than not. And so just take a moment and consider. Maybe even take a breath. I'm a bit obsessed with taking breaths. You'll see that over the next few videos. So take a breath. While you're breathing, think about your family and the relationships in it and your relationship to your loved one who's struggling. How has it shifted since symptoms have come up and since the mental health issue has been there? What tends to happen is that your actual parent child or caregiver child relationship reorganizes. And so it may feel like you're walking on eggshells more. What can also happen is if there's siblings in the family, then sibling roles shift. Maybe the sibling who isn't struggling becomes more distant, or they themselves become really resentful towards their sibling who's struggling for putting a burden on the family or for different symptoms that are coming out. Or maybe they become more of that parentified role where they're on the team to help their loved one, their sibling, recover, but then they themselves aren't necessarily in the child role and they're taking on more of a responsibility of a parent or any variation. What about your partner relationship? I will be the first to say that if you are questioning your partner relationship in the midst of the storm of helping your loved one recover from a mental health issue, if there's any way that you can pause making any big decisions while you're helping your loved one through the storm, just know that helping someone with a mental health issue can put a burden on your relationship like you would have never expected and can absolutely make you question things or question the way that you get along and increase volatility. I'm going to talk about that at the end of today's video around animal models and different styles of relating and how it can actually increase that disconnect in partner relationships due to the fact that the mobile has shifted. The other thing is think about, so the individual who's struggling has now become the center of the mobile. So everybody has shifted, which means that behaviors have shifted and patterns have shifted. Maybe you notice that you don't have as much fun anymore. Or maybe you notice that you don't have as many comfortable, open conversations, or you don't eat dinner together anymore, or you're doing things that you never would have dreamed of doing as a parent because you're so worried that if you don't, that your loved one will get worse. Or maybe you don't go out as much, or maybe you don't come home as much. And so think about any of the patterns in your family and in your relationships and how they're connected to your loved one struggling, walking on eggshells, worrying about saying the wrong thing, worrying about telling people what's going on. So any of these different interactions can actually possibly maintain the behavioral issues and the emotional issues. So I said in the beginning of this webinar that family patterns and parental patterns of emotion avoidance can actually lead to the development and ongoing struggle. And this is a part of it. And it doesn't mean you caused it. And I'm going to show that to you in a few slides. But what it means is that you could be stuck in these ways of relating without even knowing it because you were literally in survival mode. Okay. I will be the first to say you're in survival mode. There's actually research done decades ago. This was specifically with families with eating disorders. And what they did was they went into families who had children who were struggling with eating disorders and they looked at the family patterns. And what they saw was that it was chaos. So they decided to do things called parentectomies. And what that meant was they literally like removed the parent from the child's life. And they thought, okay, well, the family patterns are chaotic, the parent-child relationships are chaotic. And so if we just remove the parent, then the child will get better. What do you think happened? The child did not get better. And they were like, wait, what? What's happening? We thought that this connection was causing the struggle. Now, although the patterns were maybe perpetuating the struggle, it did not cause the struggle, and removing the parents did not help the person get better. If anything, it made them feel worse. So then they had the hindsight to go into families of individuals who had chronic health issues, cerebral palsy, other chronic issues that were being dealt with. And what they saw was that whenever there's a child who has an extreme chronic, enduring, life threatening illness, the family reorganizes. Okay. So whether or not the issue is mental health or physical health, what can happen is that the family reorganizes around fear and maybe disconnect and not knowing necessarily what to say or do, and they reorganize into survival mode. So if you notice that any of these patterns are happening, I want to tell you it is normal. You are in survival mode for offering your loved one support. The reality is, though, is that if you stay in these patterns, then you're all going to keep getting wrapped up and not necessarily know what to do or say. And that can perpetuate the struggle. And so we're going to work together to identify how some of these patterns are coming out and help you to shift them in a way that feels manageable and doable so that any possible risk of maintaining that emotion avoidant connection in the family can be decreased. So, quick review. Although I'm going to make it a little longer than quick because I think it's important that you understand the various ways that mental health issues develop. There are lots of them, and I don't have them all in these slides to come, but I do have quite a few of them that come together to create the perfect storm. So follow along with me as we talk about them. Notice how it doesn't say parents anywhere. Sure, it says family environment right here, and we'll get to that. But the one thing I want to say before I go through all of these is that these 8 slides, and there are more than 8, but these are kind of some of the 8 power players that contribute to the perfect storm of the development. They all have equal roles to play. So notice which ones I say that stick out to you more and make you want to kind of like hang your hat on them as the reason why your loved one's ill. And notice which ones you don't pay as much attention to, because that might be a clue of some of the ways that you are conceptualizing the development of your loved one's struggle. And what can happen is that if we have high levels of self blame, we tend to put more of a focus on the family environment, emotion processing, and life stressors when actually all of these issues are to play. So just be curious as I go through them. So the first one is genetics. And I'm not a geneticist, but what I can tell you is that genetics is like having a light switch. And the switch can be flicked on or off depending on the environment. And so when that switch gets flicked on, it's on and it can absolutely be dealt with. But just because someone has a predisposition to struggle with depression and eating disorder, anxiety, psychosis, doesn't mean that they're going to necessarily struggle with it. However, there is a predisposition there. The next one is temperament or superfeeler. And you will notice that there is a superfeeler handout pasted below this video so that you can take a look at the actual definition of it and share it with your loved one. But what we tend to see is that individuals who struggle with mental health issues are more on that superfeeler spectrum, meaning that they have that temperament that is more aware of emotion. They walk into a room, they can pick up on what's going on around them. Maybe they pick up on your emotions and then they do something to either help dampen your emotions or help dampen the feeling of emotions inside of themselves because they have a higher level of sensitivity to emotion. So I know that I myself am a super feeler. Currently, I would call it a superpower, but growing up, it did not feel like a superpower. It just felt like everything hurt. Walking down the street, I saw a homeless person. I felt like a horrible person. It hurt my heart. I couldn't barely handle it. If anybody said anything to me, even if it was just a passive comment that wasn't meant to be mean, I would interpret it as like total disrespect and rejection. And I would pick up on the emotions around me, and then I would try and like shift myself to be what those other people needed so that they could feel more comfortable, because if they felt more comfortable, I would feel more comfortable because I didn't have to sit in their distress. So as much as it can seem like, oh, I was taking care of everyone, ultimately I was trying to take care of myself because I didn't know how to handle the big feelings that were going on inside. So I was just trying to mitigate everything around me so that I didn't have to feel those big feelings. Since then, I've grown up, I've done therapy, I've had support, and I can tell you that when you start to increase that self-efficacy with emotion, all of a sudden it doesn't hurt so much to live in the world. You don't have to avoid emotion so much to live in the world. But what you may be seeing in your loved one is that they themselves are a super feeler. Now, a super feeler may not necessarily present as somebody who's highly sensitive. They may present as someone who's highly shut down because from a young age, it just hurts so much that they learned how to become more shut down. But I'd be really curious to have that conversation with them and just say, like, do you notice other people's expression of emotion or pain? And do you notice it in yourself? And what do you do to handle it when it comes up? Because more likely than not, they are doing things to mitigate the emotional pain inside of themselves and control the environment around themselves to not have to be sitting and stewing in anyone else's emotion. And this can be true for big emotions too. So I'll maybe talk about this towards the end of the video series, but big emotions can also be joy. People can be really evoked by the positive emotions that you think wouldn't actually evoke them, but because they're big emotions and they just don't necessarily know how to navigate them, it can be really evocative. The next thing is family environment. So we talked a little bit about those patterns of connecting. So what's going on in the family environment? Is there disconnect in the parent relationship? And are there things happening like divorce, or are there stressors in the family? And what's the family emotion coping style like? And so it can be really curious to see, like, what was family environment like when your loved one was developing the struggles, and what's it currently like? The next one is epigenetics. We're now just learning that genes can actually turn on or off depending on what's happening in the environment. We still have a lot to learn about this process and why it occurs, but it's just important to note that the environment can actually impact the presentation of someone's actual genetic coding. The next one is social and cultural factors. Living in North America, I will be the first to say that we don't necessarily live in an environment that supports authentic expression or the invitation for vulnerability or painful emotions to be expressed. We live in a culture that says, like, put on a smile, look on the bright side, act in your stereotypical gender roles, succeed. And now add on to that, we have increased technology, which you would think would make us connect more. But I would argue, and I won't go off on too much of a tangent for this because I have my own thoughts about this as I'm parenting in the world and learning to navigate it. But access to email on our phones and access to what's going on in front of us on like a kid DS or on a phone or on an iPad, and also the increased radiation and the stress on our body. And so there are all these different factors in our culture that disconnect the peer orientation, which I'll talk about in a little bit, that literally leads to a disconnect from themselves. Because who, if anyone, I mean, I know I certainly can live up to all of the stereotypical expectations in society about the roles that we're supposed to be in, and then add on any cultural components. It's almost like sometimes we're being invited to disconnect from who we authentically are to make sure that we fit in with everyone else so that we're okay. Now, it's exciting to see that there have been a few revolutions in our society and that times are trying to change, specifically around expectations of what people look like or act like. But how we currently are living, we do not live in a society that as a whole, especially if you look at the media and everything else, invites individuals to authentically express how they're feeling. And then add on life stressors, past life stressors, but also current life stressors. Think about when you've been stressed out in your world. I know for myself that when I'm stressed out, I'm less capable as an individual. I'm less present as a mother, and I don't have as much brain power to be able to navigate and problem solve situations that are going on in my immediate world. No matter what those stressors are, whether they're trying to figure out how to move or trying to figure out financial stress or trying to figure out a disconnect in relationship or maybe a bad mark on a test in school, or for adolescents who are trying to figure out where to go for university or navigate social situations or in high school, or maybe they're involved in a sport or an extracurricular and there's a competitiveness around it. So life stressors can be anything that makes us feel like we have stress. Stress in our body, stress in our mind, stress on our nervous system makes you feel like you have something extra that you're carrying. Life stressors are important to notice because when we have life stressors, we have less capacity to cope. And so if someone's in a constant state of feeling like they have stress going on, then this is going to make them less able to navigate painful or emotional situations. And then puberty. So whether your loved one is currently an adolescent and going through puberty, or they are older and have gone through puberty, it's important to note that puberty is a time of learning how to connect yourself and navigate high emotions and hormonal changes that are coming up. I was really reminded of this when I was in my weeks post-pregnancy, and all of a sudden I felt like I was back in high school emotionally. I was like, what is going on? And then I was reminded of the power of hormones. So it's not just this piece, but I want to credit that when puberty is going on, hormones are shifting and they can make everything feel like a way bigger deal and make emotions way harder to navigate. As well as during puberty, individuals are starting to identify who they are. They're starting to really lay down the formation of identity. self-identity, personal identity. And so depending on what's going on for them at the time and how they're navigating those situations, they can start to imprint their beliefs about themselves, about worthiness, the world, connections. And then if you kind of make that a little bit more macro in your understanding of it, puberty is when people are in high school. And so add on the stressors of high school and how they're navigating your identity in those situations and what's going on. So whether your loved one's currently dealing with this or you notice that some issues started to come up during puberty, it's always really curious to go back to that point and see like how grounded was that individual with themselves? How did they navigate it? How much of a talker did they become about what was going on? How much did they believe that they could handle it? And as their brain was further developing and as their relationships were further developing, did they become more connected to who they were, or did they start abandoning more of who they were? And the last piece is emotion processing. So emotion processing is just about how your loved one experiences emotion, can be connected to super feeler, how they express it, but then more importantly, how they process it. So healthy emotion processing means that we have a feeling in our body. We are able to identify like, I feel sad right now, or I feel angry right now, or I feel embarrassed or ashamed right now, or I feel a bit anxious, which is more of an emotional state, or I feel scared because there's legitimately a threat to my life. Or I feel joy, or I feel jealousy, or any variation. And so the individual can identify what's going on inside of their body. They can understand and label it. In the words of Dan Siegel, and if you haven't heard of Dan Siegel, he has a great book out there called Brainstorm. So if you're parenting an adolescent up to the age 24, I actually think it's good for anyone. But it has some really great tips in how to offer support. He also has a book called Whole Brain Child for younger children, as well as just other books on mindfulness and emotion. But he says you've got to name it to tame it. Meaning, if you can label what's going on inside of yourself, then your brain has a better chance of regulating and calming down. Because the minute that you can say, I'm sad or I'm angry, there's more of a chance that your body can reorganize into active mode around what you need, whether it's comfort or set a boundary or protection or whatever. This isn't a really common thing in our world. We kind of aren't the best processors of emotion, and usually we have some emotion avoidance going on. So if you just think about your loved one, like when they feel sad, do they show it? Do they express it? Do they talk about it? Do they seek comfort? When they feel angry, do they show it? Do they express it? Do they healthily set boundaries? Do they take space but remain in connection? When they're anxious, do they have support to go and get exposure to it? In terms of asking for help to overcome it, which is a really tricky one because anxiety, that emotional state can be fooling. It can make us feel like, oh, I don't want to go there because it's this anticipation of what could happen, when in reality, what we need is exposure. I'm going to talk about that in a few videos to come. At the end of the day, though, I think it's safe to say that we live in a culture that is not the best at emotion processing. And so you likely are going to realize that your loved one, as well as possibly yourself, when it comes to a relationship with particular emotions or all emotions, you maybe don't necessarily go through that process of knowing what's going on in the body, labeling it, and then reaching out for support to get through it. If that's where you currently are, that's okay. Because it's not where you are, it's where you go. And these videos are an opportunity to help you look at where you are and remember, say like, how many bricks do I have put down? What's the next brick that I can put down? So prior to learning about emotion-focused family therapy, I myself didn't have this awareness. For sure, I was functioning in a way healthier way than when I was younger in my emotions, but it was so powerful to learn how to actually identify and label the emotions, and that each emotion physiologically has a need. I'm going to talk about that in a few videos to come, because emotion processing can be such a key factor in getting out of the current struggle that you're in. So I mentioned a lot about super feelers, and I'm not going to show the video in this video series, but I'm going to tell you that you can go to YouTube or you can Google Gabor Mate, no two children have the same parent. Because I think sometimes, especially if you have more than one child, you may be asking yourself, like, what did I do or what didn't I do? And I just want to acknowledge that no matter how amazing of a parent you were and how equal of a parent you were to all of your children, it doesn't necessarily matter so much, because your child has a temperament themselves and they're going to have their own dynamics of relating from the womb. And so you could have been the same parent for 9 children, and Gabor Mate talks about this. But those 9 children would have experienced you as a different parent. And some of them would have said, like, oh, you were a great parent. Some of them would have said, I didn't get what I needed, because it was how they were perceiving and receiving what you were offering. So if you have any levels of self-blame or any questions of wondering, like, what is going on, just know that there's no answer that's one size fits all, and that it can be really powerful to understand the ways that you interact with your child, because you may find, like, I have such an ease of interacting with 1 or 2 of my children, but this other child, I just don't get it. Like, I'm the same parent to them, but they say I'm not. What's going on? There are some components. So if you're curious to learn more about that, it's not a very long video. Gabor Mate, no 2 children have the same parents, on YouTube or Google, and you'll find that video. So we've talked about all of these. We went through some of the factors that can develop mental health issues, but also lead to the ongoing struggle with mental health issues. I want to just target 2 of them. So if you have any level of self-blame right now, you might be saying, like, see, the family environment. It's not that. It's that we literally can't change these 2. We can't change these 2, and we can't change these 2. In terms of where they currently were. And so what we can target, as I'm working with you in this caregiver series, is emotion processing. And I'm going to teach you how to do that in the videos to come, specifically around how to offer support and help your loved one identify their emotion, work through them, and how to help yourself navigate any of the feelings that come up around emotion and fear and everything else when you're thinking of offering your loved one support around emotion. The other piece is family environment. Because remember what I said is that mental health issues can literally shift up the entire mobile of the family, and can mean that it impacts the way that you relate with your loved ones. So if we can help target the family environment in a way that's going to help shift up some of those interactions, then you may be surprised to see that it can literally reorganize that whole mobile and help bring a little more space and flexibility to your loved one's journey. Just a little note about the event. So what do I mean by this? Sometimes as caregivers of loved ones who are struggling, we can have a story in our heads of what happened. Story in our heads of what was traumatic. Or I've worked with quite a few caregivers who are trying to find that story. So if I could just know what happened, or where it went south, or where it went wrong, don't be fooled by the event. 2 individuals can have the exact same experience, and yet one of them can develop a mental health issue, and one of them can end up getting through it and leading a healthy, thriving life. So it's not so much about the event. It's not what happened. It's actually what happened next, a couple of times for your loved one or for the individual. So someone can have the exact same experience as someone else. One person develops a mental health issue, one person doesn't. First of all, just so you know, one event in and of itself does not lead to the development of mental health issue, nor do 2 or 3. What's more powerful is the disconnect from emotions and how you coped with the pain that came from the event. So if you had an experience, or if your loved one had an experience, and they were able to identify what was going on and have a healthy expression of anger or sadness or grief or whatever, and connect about it, then they likely wouldn't have internalized that pain. If they had an experience where they had some kind of like disconnect, they had a painful experience happen, and then they actually disconnected from themselves and their needs, denied what they actually needed, and started using unhealthy ways of coping to manage and navigate, then that event probably will stick. So what's trauma? An event can be experienced as traumatic, but when it turns into trauma that is experienced in the body and the traumatic situation, it means that the individual disconnected from themselves and they had maladaptive functioning or coping in order to manage the pain that was coming up. So if you think about vulnerabilities in the individual or in the family, there could have been traumas that occurred, but in order for them to become traumatic to the individual, they disconnected from themselves. They used unhealthy ways to cope with the pain because they didn't know how else to navigate. So we've talked a lot about how you can reorganize as families in terms of all of the different relationships that are coming up. So you may think of times where maybe your loved one struggled and then you reorganized a little bit around that. Or you yourself struggled and then the family reorganized a bit about that. That's normal and that happens. The good news is that we can change the ways that we've reorganized. And even if your loved one developed that traumatic response to what was going on for them, you can help them stop using maladaptive strategies to cope with the painful emotion. And you can help them to better be able to manage what's going on through the way that you offer them support emotionally and behaviorally, which I'm going to talk about in videos to come. So, EFFT, emotion focused family therapy, what are some of the fundamentals? I want you to know that this is how I practice. And so, as I'm offering you this video series, this is where I'm coming from. The first one is family focused. So you can probably notice that I'm focusing a lot on the family and the patterns in the family. Now, you may not be watching this video series as a family. You may be, as I mentioned, an alternate caregiver or a clinician learning the skills. But I do practice from that family focused perspective because at the end of the day, families are like the most potent environments and relationships to be able to offer support towards healing. Now, if you've ever grown up in a family, you may realize that that sometimes is where the most chaos can happen, the most disconnect can happen, right? But in that disconnect, if that's what you're feeling, that is also the place for healthy connection and for almost like a rebirth of relationships and connection. So no matter where you are in your family relationships, just know I'm being family focused for a reason because it is powerful. And with 1 degree, we can make that shift. But it's important to know that we're being family focused. The next one is parent empowerment. I mentioned this before. As a parent, I believe in you 100%, 1,000%. I will argue anyone down. I will take a second to see it from your perspective about maybe why you don't believe in yourself. But I want you to know no matter what you've done, no matter where you are, no matter what your struggles are, no matter how burnt out you are, I believe in you 1,000,000%. Because I also know that you don't have to be a stereotypically perfect parent to help your loved one heal. And don't get me started on that because I myself am a parent and I can tell you I do my best, but I ain't stereotypically perfect, and who is? And kids don't need perfect parents to thrive. And so I want to work with you until you believe that you have the right to offer support to your loved one because you have every right no matter what's happened, and you can absolutely support change no matter where you are. The next piece is skills training. As much as I'm saying you have the right and you can do it, we don't always have the skills. I mean, I can tell you myself, I teach this stuff and I still sometimes review my skills as I was going through the toddler years. And so if you're, navigating any uncharted territory for yourself, it makes sense that you're going to need to learn skills because you maybe didn't have them. Now, a lot of the time we go off of intuition, and if that's working, do it. But sometimes our intuition isn't working, or we maybe just have blocks ourselves, or we were never taught how to deal with it. And so it is very normal and appropriate to need skills. And I am a big believer that it's fair to need skills and that you should learn new skills to help your loved one if you're feeling stuck. If what you're doing is feeling like it's working, great. But if you're feeling stuck, then please come with me on a journey to learn new skills so that hopefully you can manage to shift up a few of the dynamics. Next one is focus on emotion processing and nervous system regulation. I'm going to talk a lot about that in this video series. So a lot of the focus is on that emotional self-efficacy, because if someone has higher levels of emotional self-efficacy, they're better going to be able to navigate situations that are coming up. The other thing is that if they can regulate their nervous system. So I talked a little bit about the stressors that can happen, and think for yourself. Like, just notice actually right now, as I'm talking, I'm noticing the stress in my body. What's going on inside my nervous system? Meaning, like, where are you feeling the stress in your body? And what is getting pushed down and shoved inside of there? And so, what can often happen is as we have emotional experiences, we feel the stress in our body and the impact it has on our nervous system. And if you have low self-efficacy with managing that, it might mean that you just sweep more under the rug because it's like, I don't know what to do, I'm going to ignore it. But then what that does is it sweeps more stress into the actual body's central nervous system. So it means that you're functioning at a higher level of stress. And when we function at a higher level of stress, we need more extreme ways of coping to help numb out those feelings of stress. The other thing that's so important in EFFT is transparency and collaborative decision making. So even though I'm not working directly with you to make decisions, I want you to know that I believe in transparency in terms of like speaking the unspoken and looking at what's going on. And so I will do my best in this video series to model that to you in terms of how I connect about different pieces, because I think it's so important to know that we're human. And as humans, we have the right to accurate feedback, even if it's going to hurt. And we have the right to be able to collaborate in making decisions around care for ourselves and our families because we know best. Even if we don't have access to that knowledge right now, I'll help you with that. At the end of the day, you know your loved one better than anyone else, even if you try to convince me that that ain't the point. I'm going to prove you otherwise, or try. And then 1 degree effect. So I've talked about this a lot and I'll keep talking about it, that I really do believe that 1 degree of change can make an astronomical change. So if you think about being lost in the woods and your compass is your way home, you know where you need to go, and then the compass goes off by 1 degree, you're not going to end up on the path home. You're going to end up in the middle of the forest somewhere. Similarly, an airplane that's flying from London to New York, if their flight path is off by 1 degree, they're going to end up somewhere in the Atlantic Ocean. And so just know that in the long term, one step forward, one change can make a huge impact. But our goal is to find what the 1 degree is and just keep building on the 1 degrees so it's manageable. Rather than thinking that you have to change 10 degrees, 50 degrees, 100 degrees at a time, that ain't sustainable. So please know that I would much rather you have change, like 1 degree of change consistently or when you can, and have it be mastered and stick, than try to make drastic changes that actually end up leaving you feel disheartened, exhausted, burnt out, and like you just don't know how to go on. So the foundations of the work, just a little bit of a review. Mental health issues have a huge impact on families. You as a caregiver do not cause mental health issues. Causes are way more complex. You don't have that power. Emotion avoidant dynamics are believed to contribute to or feed the mental health issues. But more importantly, they're actually a way out. And it's something that we can change with advanced caregiving, which is why I want to teach you advanced caregiving. And these skills are not skills that you typically would have. So as I teach this, you may notice regret or grief or anger about the fact that you maybe didn't have these earlier in your loved one's journey. So I want to honor that and offer you support to work through that. But I also want to acknowledge that you didn't need these. These are advanced. You shouldn't have these typically, and you shouldn't need these typically. And so it can feel a bit frustrating if you're like, oh, if only I'd had those. And we can't say what would or wouldn't have happened if you had these skills earlier. But what we can say is that these are a way out now. So wherever you are, wherever you're starting, no matter how far into the journey you are, you absolutely can help make some shifts through learning some of these new advanced skills. Where you come in. If I haven't already convinced you, you are key in recovery. And the research actually shows that success rates increase astronomically when caregivers and families are involved in recovery, because you can help your loved one interrupt symptoms, get back on track with development and with life. I quite often hear caregivers tell me, like, my child is an adult, but she acts like she's 13. Or, you know, he's 18, but he acts like he's 9 in some ways. Or maybe there's less of an extreme disconnect, but you may find that chronologically and developmentally, it doesn't fit. That is normal with mental health issues. The way that I look at it, and this is just my own way of conceptualizing it, is think of when stuff started going sideways for your loved one, whether that was symptoms came up, but usually disconnect happens before symptoms come up. So whenever they started to really struggle, it's almost like they stopped healthy development and they got kind of paused in this emotion low capacity place. So they were growing up, they were doing the things, they may even be really, really smart and can talk to you in circles, but emotionally, developmentally, they're way back there. So by doing some of the emotion-focused family skills, you can actually help them to get more on track with where they are chronologically, help them increase capacity with emotion, and then move forward. And you can do this whether you live across the continent or across the house from them. I work with caregivers who live in different provinces or countries than their loved ones, as well as I work with caregivers who live in the home. We've talked a bit about this. So you can support behaviors, interrupt cycles of emotion avoidance, heal old emotional wounds so that your loved one can heal from within and no longer need symptoms to cope. So this video series is a part of the caregiver workshop that is offered around, although I know not everyone has access to it. So I will be covering most of what's offered in the caregiver workshop. However, there are some techniques that are better done one-on-one or in the actual in-person setting. So whether that's over video live or in an actual room with other caregivers or in a session with a clinician. So at the end of this video series, I will give you recommendations on if you want to further deepen how to access EFFT clinicians and how to learn more about the materials that are available. But for now, just know that I'm going to be going through behavior coaching at the very end of this series, emotion coaching in the middle, emotional blocks in the beginning, and healing of old child caregiver wounds will not be covered because that is something that's very personal that not every family needs, and that I recommend doing one-to-one or in a live group setting with a clinician. So I can give you more information at the end of this series. You still feel like you want more support in that area, I will give you more information about where to go for that. But let's talk about part one, advanced caregiving, working through emotional blocks. Now you might be wondering, Kay, that's great, but I came to this video series because I wanted skills. Give me skills, woman. There's some reasons why we actually don't start with skills. Skills are important, and I've said that, but the reality is that if it was just about skills, I could tell you to go to Chapters or Indigo or another bookstore and buy a workbook on how to support your loved one behaviorally. And if that was the case, none of us would need jobs and it would be super simple. But what we know is that it's more about than just knowing it in here. It's about being able to work through that little voice inside your head and work through any fears and have a really good groundedness in what's going on. So emotional blocks truly is one of the most critical components of the work, because fears and emotional obstacles are going to surface for you. It doesn't mean that you're weak or that you're unevolved. It just means that you're on a parenting journey. And it's a novel journey in a lot of ways, especially if your loved one has mental health issues or behavioral issues or substance misuse issues or any other variety of presentation that is connected that can be supported. And so it's a novel journey, and you don't necessarily have the skills because you weren't given the manual for those pieces. But the other piece is that whenever anything's new, whenever we're on a new part of our journey, we don't necessarily have the same blueprints to know how to navigate it. And so it's important to be able to learn what's going on inside of ourselves so we know how to take steps forward. These fears, which I'm going to get into detail about now and in the next video, are normal. But if they're not processed through, they can actually interfere with the way that we offer care and the way that we can be effective in offering care. But they can be very convincing to us, these fears, and we're going to talk a bit about that. Remember how I told you that even clinicians have them? So if you're human, you have emotional blocks. Emotional blocks are normal. The more awareness that we have, as I said earlier, the better we can navigate it and get out of it. So what's a caregiver block specifically? It's a combination of emotion, of related attitudes and behaviors, and of love and wisdom. So the first one is maybe you're stuck in fear, shame, self-blame, hopelessness, helplessness, resentment. And I don't mean that you have a fleeting emotional experience. I mean, any of these emotions would be normal as you're kind of navigating the day-to-day of parenting someone who's struggling. But it's when we get stuck in them and when the story gets very convincing. And when they result in attitudes or behaviors, so in the second piece, that interfere with being able to offer support or increase our accommodating, enabling, or obstructive behaviors. And they can also influence your outcomes for your loved one. So it's important that we look at these and understand them. The last piece that I want to acknowledge, though, is that they're fueled by love or wisdom. So there might be some wisdom coming up in the block, and we'll talk a little more about that in the next video. And so it's important to move through the maladaptive emotion, so that stuck emotion, and see what those thoughts or behaviors are that are connected to it. But also see what the wisdom is that's connected to it, because then you can choose how to move forward. It's not a question of if you move forward, and that's quite often what caregiver blocks can do, is they can kind of like get everyone stuck in their tracks around particular ways of offering support, and then it feels like there's nowhere to go. So we're going to look at how we can actually harness that wisdom and then figure out how to move forward, not if. And I always say that to clinicians and parents I'm working with. If there's stuckness, okay. So we need to allow the wisdom to inform how we move forward, but we don't get to just stay stuck here. Otherwise, those patterns are going to keep going around and around and around, and you're going to feel like you're chasing your tail in many areas. And this is true. Many caregivers I work with often say, like, I feel like nothing's changing and we're kind of stuck here. So it can be really helpful to take a look at what's going on inside of me. What are my beliefs, and how can I use that to move forward in a great way that's helpful and not stay stuck? So we've talked a little bit about how mental health issues and your own emotions or emotional past and emotional style can actually exaggerate normal caregiving patterns to the point where they can inadvertently maintain the problem. So we end up changing how we feel and the way that we care. And there are actually some metaphors that are used from Janet Treasure in the Maudsley Hospital in London, UK. And they might seem a little bit weird at first, but I can tell you that they're a great way of lightening up the dynamics that can happen and also conceptualizing them in a way that's relatable and accessible. So there are 3 types of emotional responses and 3 types of caring responses. So the emotional responses are how you respond in the face of your loved one's emotion. And the caring styles are how you respond in the face of your loved one's need for practical support. Now, we all have these. As I go through these, think about which one you are most like in response to your child that you're here today learning about in those toughest moments. So it won't always be like this, but in those extreme moments with the child whom you're here to learn about, think about which ones you are. So the first ones are the emotional responses, and there are 2 extremes in the emotional responses, and we all fall into one or the other, and it might be different with different people, but think about that particular person. So when your loved one is having emotion, when they're expressing emotion or experiencing emotion, are you more likely to feel your own emotion in a big way, struggle to keep it in check, possibly show your own emotional distress, feel wobbly, and then maybe go on an emotional roller coaster with them wherever they are? So this might look like, I'm only okay if they're okay and they're not okay right now, so I'm not okay and I'm really worried and I'm really anxious. Or it might look like as their fear comes up, you notice your fear come up, or they're having a big emotion, and so all of a sudden your insides get like really evoked and you feel everything and you feel really on edge with what's going on, and so you don't feel as grounded yourself because of the emotion that's going on in them. And it may even feel like whenever they have emotion, you can't settle. The other extreme is the ostrich. So this would be where you technically, metaphorically, have your head in the sand. So maybe you don't necessarily see what's going on in your loved one when they have emotion. You don't think about it when they have an emotion, and you just don't deal with their emotions. So maybe you subconsciously see that they're having an emotion, but instead you focus on channeling your support practically to try and make it go away. And so it's like they're having an emotion, but you don't see it, but instead you're going to focus on, getting dinner ready or making sure they get to school on time, and just focusing on how you can practically make it go away by moving through the moment. Maybe you even buy them something to make them feel better. So 2 extremes, right? And you're not going to be this all the time, but it's in those extreme instances where it's the toughest to manage their emotions. So are you the jellyfish or are you the ostrich? Now, I'm only going to let you choose from these 2 because these are the extremes, and it's important to see in those extreme moments where we go. There's a third that I talked about, and I accidentally just gave you a little clue of what it was. So the third is the St. Bernard. Now, we are never the St. Bernard all the time, myself included, but it's something that we can strive to become, and you'll see that you have an actual paper resource about the animal models beneath this video. And so it goes into a little more detail about each of those animals. What we're striving to become is a St. Bernard, because this is where, in the face of your loved one's emotions, you're able to offer support. You have curiosity and interest around them. You're able to affirm them they're going to be okay. You're able to validate them. And it's like you believe that you can handle the situation, but you're not drowning in the situation with them. And you're also not pretending like the situation doesn't exist. It's the balance of both. This is what we strive for. We're never this all the time. And I'll tell people, like, you don't get to choose that one because I don't want to know what it's like on your best days. Your best days, you don't need my support. I want to know what it is like on your worst days or your scariest days or your most painful days, because when we know how deep the bottom is, then we know how we can push off and go up. And so a lot of my clients who work with me will say like, oh, okay, I have so much to tell you, but I actually was just thinking that I'm going to tell you about the thing I least want to tell you about, because I know that that's going to be what evokes me the most and brings the most change. Um, Now that can seem a little bit extreme, but I just want to acknowledge that I want to invite you to look at like the hardest times, the worst times, because then you can see the reality of it. And I think sometimes when we're offering loved one support in the struggle, it can get easy to live a bit outside of reality because reality hurts or it a little bit burns us. Um, and although I in no way want you to sit in that all the time, I mean, we need distractions, we need joy, we need fun and excitement. So we'll talk about that in a little bit. But we also need reality. So are you more likely to get flooded by their emotion and get overwhelmed by their emotion, or are you more likely to avoid their emotion? I encourage you to write this down and connect to someone about it. And then know that there's a way to find the balance. You won't be this all the time, but you may be this a lot of the time already. But in those extreme times, this is where we want to aim for. The next ones are caregiving styles. So, what caregiving style means is that think of a time when your loved one needed practical support. And this is where your caregiving styles come in. So, there are two extremes. There's the kangaroo. So as you can imagine, see, there's the little baby in the pouch right there. The kangaroo is overprotective. They really want to protect their loved one from the challenges of life by putting them in their pouch. So remember, this is when offering practical support. So maybe the treatment team made recommendations for symptom interruption, and you go to try and enforce them, and your loved one is starting to really, really struggle. And so you're like, you know what, honey, don't worry about it. I know they said that this was too much, what they recommended this week. So we're just going to tell them that it was too much. We're not going to do it. It's going to be fine. Or maybe this is where, they have a homework assignment that they have to do. And trust me, I'm not against this because I definitely got support as a kid. And I'm sure I'll give my child this support. But all the time you're going in and you're doing it for them and you're helping rescue them for any of the struggles that are coming up in the world. So it's almost like you want to protect them, but you want to protect them so much because you're worried about them having any distress when it comes to practical needs, that you essentially jump in and take away the struggle for them. The other end of the spectrum is the rhinoceros. So as we can imagine, the rhino is charging in with its horn, it's controlling, constantly giving advice and trying to really argue for change. And so on the one end, you have that kangaroo where you're trying to protect them from the practical struggle. On this end, rather than trying to protect them, it's like you want to force them to be able to do the practical struggle. So it's like, nope, you have to do your homework. You're going to sit there. You have to do it. Maybe you're arguing with them about why they have to do it. Or similarly, if the treatment team gives recommendations, it's not necessarily acknowledging the struggle, but just ensuring that no matter what, those goals are met. Because if they're not met, then there's going to be no growth. Now, this can actually lead to a cycle where your loved ones become really defiant. So I'd be curious to see, and all of the different presentations can lead to different cycles. But for this one, if you're wondering, am I rhino, am I kangaroo? Is your loved one becoming kind of defiant every time you try to offer them practical support? And if so, that might be a clue that you're charging in more. Now, remember, two extremes, and there's a balance of both. But just ask yourself, am I more the kangaroo? Do I want to rescue my loved one when they're struggling practically and maybe just say, like, don't worry about it? Or rhino, where you charge in and at all costs you're going to make sure that it happens and that they learn from the situation and that you're very persuasive in ensuring that they take those steps forward. Not all the time, extreme times, with the individual you're here to support. It can be different for different children as well as myself as a clinician. I've identified my animal models clinically, and then as a parent, I'm way different. And so just be curious about different relationships. And yes, it can be different, but just know that with that one that you're here to support. The balance of both for the caregiving style is warmth and direction. So you do want to have that care, like the kangaroo, a little bit of the warmth, but you also want to have direction so that you can help guide your loved one. So the dolphin is a great example because it's just enough direction. The dolphin follows when possible, so it lets the individual guide the way, but it also takes charge when necessary. So sometimes it swims in front, guides, sometimes it swims behind and follows, sometimes it swims beside. So it's a balance of sometimes leading, sometimes following, sometimes offering that support and taking down the struggle, and sometimes really coming up behind and encouraging and pushing that loved one to go to the nest a little bit. But it's a balance of everything. And more so it's about looking at where is your child currently, and how can you help them to move forward in the best way. So are you a jellyfish with a pouch? Are you a rhino with its head in the sand? Are you a variation? Are you a rhino with a pouch? Um, and so there are different ways that these can present. And it's really important to understand that if you're caregiving with someone else, whether you're working in a group home and there are other staff, or you are part of a couple relationship, or you're caregiving as a co-parenting relationship, and so your child's going back and forth, or the care is going back and forth, that you can actually accidentally reinforce each other's dominant styles. And this happens like across the board. It can happen no matter if the styles are the same or different. So my co-parent and I, as parents, are both kangaroo jellyfishes. So we're very emotional in those extreme times, and we are very overprotective in those extreme times. And we've had the conversation about sometimes we're doing like the overprotective thing, both of us at the same time with her, and we'll look at each other and be like, oh my goodness, we're being emotionally evoked by her struggle, and we are charging in to try and take away that pain and that struggle to the point where we literally are like suffocating her in our pouches. It's our own little reflection. But because we're both the same style, we literally can just build and build and build and build, because there's no alternate reality when we're in those extreme tough moments. It's just the reality of jellyfish kangaroo. The same can happen though if you have alternate realities in those situations. So if you're a jellyfish kangaroo and your partner is an ostrich rhino, what can happen is that you'll be so involved in trying to rescue your loved one and your emotions being evoked, and they might walk in and get super frustrated by it, and so then they may just walk out of the house. So a stereotypical presentation of this is child struggling, one parent's in the house really trying to help that loved one, really being evoked by what's going on. The other parent walks in and is like, nope, not doing this, and walks right back out, whether it's like they go to the garage or they go to another room. And then what happens is that the caregiver, who is more of that jellyfish kangaroo, gets more evoked, because it's like, oh no, my other caregiver just left. They're not helping out. So then they become even more jellyfish kangaroo. But then the other caregiver, because they're experiencing the first caregiver being very jellyfish kangaroo, will likely stick their head in the sand further and maybe become more strict and more forceful around ensuring that the practical situations are taking place, because they're seeing that the other caregiver is not making sure that it's happening. So it can be so interesting and so enlightening to see how your caregiving styles, whether similar or different, can literally reinforce each other by almost like combating with the extremes or both running together. So I encourage you to consider what you are and to share this information with your co-parent, other caregiver, if they're not watching this with you, because it can be so powerful. Now, the one little key point I'm going to share with you about that is that it's not helpful to always point out the other person's animals or to point them out at all, especially if that person isn't on this journey. So of course, share this information, but make it less about a mission to see how their animal models are presenting themselves, and more about a mission to see how your animal models are presenting themselves, because you're going to get more bang for your buck if you're doing it that way. Although I can tell you that in any partner relationship, whether it's like colleagues at a care home or in the hospital or parents in the same home or co-parents, it can be really tempting to focus on, and there's been research done on this, it can be so tempting and so almost gratifying to focus on the other person's struggle, when actually what happens is that that can create more of a disconnect. So if you can, try to focus on your animals and how they're presenting themselves and what you're doing to possibly reinforce the other, and not about the other person. So we all need to aspire to be the St. Bernard and the dolphin. We want to increase effectiveness in the promotion of recovery. If we don't aspire for that balance, then what happens is our patterns of caregiving with behavioral changes and emotional support can inadvertently lead to maintenance of symptoms and problematic cycles of co-parenting, but also parenting and co-caregiving. So it's important to be able to identify what's going on and help make some of those changes. So we have just finished the very first video in this multi-part series. I want to congratulate you. If your head is spinning a little bit, that's normal. There's so much content that's going to come at you with these videos, and I actually recommend that you don't watch them one after the other on the same day or even like every single day in a row, because I want this to kind of integrate into your learning and for you to really try and put each of the homework pieces into action before building on top of it. So the homework for today is the animal models. And as I said, you will see that the animal models are posted beneath this video. So print them off if you can, or if you have email and you don't see the person in person, email them. If you really feel brave, I encourage you to share them with your loved one who you're supporting. Don't tell them what you self-identified as, and ask them to identify what you are. Now, the key for this is you only show them the extremes. So don't tell them about the St. Bernard or the dolphin if you can wait. Or if you're emailing it to them, I know that the St. Bernard and the dolphin is in there. Just tell them that they're only allowed to pick between the jellyfish and ostrich and then the kangaroo and the rhino in those extreme times. Because what can happen is if you have a child who is presenting as like the caregiver themselves and they're super emotion avoidant, they might just say like, no, it's fine. You're the jellyfish and the dolphin, or sorry, you're the St. Bernard and the dolphin all the time, which feels really good when you hear that. You're like, oh, good, see, I'm fine. But I can promise you that nobody on earth, like myself included, is the St. Bernard and the dolphin at all times. And so you can actually start to reverse that pattern of emotion avoidance and bring some more reality into the connection in a doable way. Put down one more brick by inviting your loved one to identify those extreme times. When you ask, you might need to take a few extra deep breaths because it can feel a little bit like blaming or finger pointy if you ask the other person to tell you. And so if you're not in the habit of having conversations where you're reflecting on, can you tell me some of the ways that I am connecting to you that are necessarily unhealthy, which who is as a human comfortable with that, then I encourage you to take a few really big breaths in through your nose, out through your mouth, letting the exhale go to about 110%. That will actually help you regulate what's going on inside, help you feel more grounded, and likely bridge that connection to stay connected when you're doing this. So share the animal models with your loved one, share them with your parent or co-parent, be self-reflective, try and have conversations to bring some more levity around the ways that you are maybe diving in or disconnecting, and stay tuned for next time. And thank you so much for participating in this very first video of this multi-part series.